Dr. Jenny, I have a question for you about food. I am curious to know what you think about the carnivore diet. I mean,
Mhm.
it's maybe similar to paleo. I think there are some anti-inflammatory elements, but
Mhm.
what is your take on that? Is that a good strategy for inflammation in general, for headaches, migraines in general? What are your thoughts?
I consider the carnivore. So here's my thing about diets, and I'm just take a step back before I answer that directly and say I don't think there's any perfect diet out there that's perfect for everyone. I think we all go through different stages in our life based on your age, based on where you're on your health journey in terms of what diet is right for you at this time. And I think it's wrong to think that there is a perfect diet. If there was, I think we would have found it by now and there wouldn't be all this fighting. I mean,
Yeah.
and that's really, and I think that in this time of all the social media that, we participate in, it's easy to get swept away and thinking that, oh, this is a new thing and this is really amazing and this might cure me. And I think that people who are struggling with chronic disease, whether it's migraines, chronic fatigue, long COVID, whatever it is, it's really easy to get into the myth of the one thing, where it's one thing that got me here, it's one thing that's going to get me out, it's this one supplement, it's this one diet, it's this one
Mm-hmm.
superfood. So I just want to back off and say that first before I answer this, because here's what I think about the carnivore diet. One, I've never been on it, so I can't come from a place of experience. I've looked at it. It feels like a very extreme diet to me. I don't think it's sustainable over the long term for people for a variety of reasons. I think that the research has shown, hands down, that a healthy microbiome is really important, and that healthy microbiome comes from eating a variety of foods. Over 30 different kinds of food in a week is the healthiest diet that we've found research wise, better than the Mediterranean diet, the paleo diet, anything. It's 30 different kinds of foods within a week. We know that those different short chain fatty acids, they need, they just need so many things that come out of fiber, soluble, insoluble fiber. We need all the different colors of the foods for all the different powerful anti-inflammatories and antioxidants. So I do not think that the carnivore diet is a long-term healthy diet. I don't think it's sustainable over the long term. I know there are some people who find that going on mono diets or very, very few different kinds of foods can really reduce their inflammation in their body and use it as a time to give their body a break. I started in the mid 90s. There was the lamb and rice diet, or, lamb, rice, and pears. We'd put these people on these super simple diets, or where we'd rotate certain foods through so they weren't eating the same food more than every couple days. It was all the same thinking in terms of get down that inflammation, and it worked. It helped. I just talked to somebody this weekend who you and I both know, who's a practitioner, who finds if she goes off her carnivore diet, her histamines rise. So
Mm.
clearly she has some underlying things to address before she can expand her diet. So I'd say that if you're on the carnivore diet and it helps, use it as a bridge to be able to support your body to heal and start working on those underlying pieces so that you can expand your diet, because I really think the evidence shows that we need more variety to be healthy.
Yeah. And you know where I bet this in 5 years, you know where I bet this conversation is going to be?
Mm.
This conversation is going to be eat in alignment with your genetics.
Yeah.
All right. Do you have some advice about non-device ways to kind of very quickly reset your nervous system? I know you mentioned gargling, humming. Are there things like that that are sort of always with you, always available,
Mm.
and pretty fast acting?
Mm. Things that I do to reset my vagal tone that's super easy is breath. I'd say the two things I do is reorienting to the space that I'm in, and that's very easy to do. Often when we are stressed out, we've gone into this survival kind of mode and brain, and we've become very focused, straight ahead, run away from the tiger kind of focus. And becoming oriented more all around us can just be a very simple trigger to shift your nervous system into more of a parasympathetic rest and digest state. So literally, and people can do this right now, is you can just literally look ahead of you and look and just notice the walls. I'm noticing this wall and these flowers. I'm seeing my bookshelf over there, looking up at my ceiling, looking down on my floor, can look over here. You can even touch those surfaces. And this is a somatic exercise. And literally just me doing that, even with the camera and the lights and everything right here, I feel my nervous system more calmed. I mean, I just go ahead and try it and see if you notice a difference. But
Yeah.
that's a super simple thing, and you can do it anywhere, anytime. So that's one that I find that orientation is very helpful. The
Presence, I feel
presence,
like that's
exactly.
half of Buddhism right there, presence.
Right, exactly. This is where I am. This is where I am. And
Yeah.
then the other thing I use all the time is breath work.
Mm,
And there's a breath work that Nawaz Habib, who's written a number of books on vagal toning, you probably know who he is. He's great.
hmm.
He has this awesome breath exercise, super simple to do, that's been studied to help with resetting your vagal tone, where it's a 5-7-8 breath, where you breathe in for 5, you hold for 7, and breathe out for 8. And just doing 4 rounds of that really helps reset your vagal tone.
Yeah, I think breath work would be my vote. That's my absolute favorite
Yeah,
quick fix for the
always with
nervous
you.
system. All right, I want to circle back and talk a little bit more about inflammation. I want to get a little bit more technical. So, symptoms aside, and we kind of talked about the symptoms, the neurological symptoms people get from inflammation, but symptoms aside, how can you really tell that you are dealing with somebody who's got inflammation?
I That's a really good question. Most of my patients do not have elevated CRP, and yet they have signs and symptoms of inflammation.
Okay.
If they have elevated CRP, it lets me know that they are in more acute inflammation. Their inflammation is more pronounced. We really need to figure out the source of what that inflammation is. And so that makes me think that the CRP is not a good enough marker. It's not sensitive enough
Hmm.
to measure the kind of inflammation we're talking about.
Is there anything you like better?
I don't know of anything that I like better. I'm looking
Okay.
for, there's a number of tests that I pull on people when I'm looking to decide if to support my thinking, if they have this root cause or not, or to rule things in or out. I do not have an inflammation marker. I have lymph panels that I'll do, or I'll look at immune panels to see
Hmm.
what their immune system is doing, and that's sort of a indirect sign of some inflammatory patterns. I'll look at I'll look at whether their body is reacting to certain types of brain tissues to be able to see what their blood-brain barrier integrity is, to see how concerned we need to be and aggressive we need to be around certain aspects around blood-brain barrier, inflammation in the brain. I'll look at those things for
Hmm.
people that I think is really concerning. But an actual inflammation marker, not that I've seen yet. And so that kind of makes me think that we don't have a test yet that's sensitive,
Yeah.
you know?
Yeah, the markers aren't great, and people can definitely have normal HSCRP and still have inflammation in their body, just like you're saying. If you do the right test, you'll find it, but those aren't widely available. So
Right,
a lot
exactly.
of people are having to treat this based off of symptoms. But I want to talk a little bit more about COVID.
Hmm.
You were kind of bringing that up, and I know that COVID can cause a lot of these
Hmm.
MECFS symptoms. Do you think there's anything different about how you would go about handling a long haul COVID recovery
Hmm.
versus the MECFS?
Yes. So when I look at MECFS and I came up with those 5 different root causes, one of the root causes is an infection. So it's a chronic infection. It can be bacterial, it can be viral, it can be fungal, it can be, any combination of those. And so I put long COVID as being the same as MECFS, and you have like the straw that broke the camel back was that COVID infection. That's the thing that kicked your body into this pattern that we call MECFS. That said, the long COVID virus has its own personality, has its own patterns, it has its own particular demonstration. Just Epstein-Barr virus is this very straight, if you treat it, it will get better, and it's a very straight shot. Long COVID, you think you're doing better, or you think you need to treat it this way, and it takes a sharp right turn and then a left turn without you expecting it. And That sounds vague, but that's just part of the thing with long COVID. I'd say one of the things that's tricky with long COVID, and if you're dealing with this, it's very important to understand, is that you need to treat it for longer than you think you need to, because it has a wicked little tail that likes to whip you as soon as you think you're over it and you're done. And you also
Mm.
need to just be a little bit more careful and cautious with some of the things that your activities for a while until you're fully out of it.
Wow. And this is why I love talking to you. I love to hear about all these niche things that you know about, where to use and when to use them. So if people are interested in learning more, where can they find out more about your work?
Go to my website, drjennytufenkian.com.
Awesome. Well, thank you so much. Thank you. I really appreciate you being here today, and thank you so much.
It's been an absolute pleasure.